Okay, Trumpcare is back, sort of, kind of. There's a new proposal again that would include the repeal of the Affordable Care Act, Obamacare. It would put in place something else. This was a major campaign promise for Donald Trump. Total failure to execute so far, right? I mean, embarrassing defeat after defeat on the repeal and replacement of the Affordable Care Act for Donald Trump. And I want to go through this new proposal with you in detail. This new proposal is from two Republican senators, Lindsey Graham and Bill Cassidy. Previously, the Trumpcare proposals or Republicare, the American Health Care Act, whatever you want to call it, estimates said that somewhere between 22 and 24 million people would end up without health care as a result of the repeal and replacement of Obamacare, compared to the status quo within the decade following the passage of these different, fortunately failed replacement bills. This new bill, which is the Graham-Cassidy bill, could be even worse. So let's start by looking at the provisions of this new Trumpcare bill. Number one, Graham-Cassidy would end the Obamacare tax credits for middle-income Americans. Absolute disaster. Number two, Graham-Cassidy would end certain subsidies for lower-income Americans. The new Trumpcare would end Medicaid expansions in a variety of states that would affect 11 million adults. It would add block grants, which would be smaller amounts than the money that's been taken away, that would be taken away. And those block grants would expire completely in 2027, which creates a total cliff situation. It would cut coverage for low-income seniors, children, and disabled people. It would end protections on pre-existing conditions, lifetime caps, and essential benefits. It would also make it so that states receiving the grant money can waive certain federal laws that protect consumers or buyers of health insurance. And lastly, and very immorally, it would allow insurance companies to charge higher premiums to people that are sick, even if they become sick after purchasing insurance. It's no longer insurance when you do that. Insurance works by averaging the risk across many buyers. And of course, mathematically, right, the more buyers, the better, so that no one person has to be price gouged, but everybody can be covered and have predictable medical expenses as their need to use those services might increase, as can happen when you get sick, as can happen when you age. If you think, well, listen, David, I don't care about this, and most people don't have to worry because most people have employer health care. Not true. It's sort of complex, but it relates to the lifetime caps and pre-existing conditions and some other elements. But check out the Brookings Institute explanation of how this new plan could affect even people who have employer health care. What will the net effect of this proposed plan be? Well, according to Andy Slavitt, who is he actually ran the Centers for Medicare and Medicaid Services under President Obama. He estimates that this plan would see not 22 million, not 24 million, not 26 or 28 or 30 million, but 32 million people end up without health care, 32 million people that currently have health care. Now, you'll notice in that number, it's worse than a straight Obamacare repeal, right? That means that the new provisions of this plan, above and beyond the repeal of the Affordable Care Act, will actually kick even more people off of health insurance. And if you read through the list with me of the provisions just a couple of minutes ago, you would understand why. It allows for price gouging, for example. It allows for the, you're already talking about the waiver of Medicaid at in many states. And this isn't just a punishment for getting sick. This is sort of an encouragement to health insurance companies to make healthcare as unaffordable as possible as soon as people get sick. This is a major profit and price gouging boon for health insurance companies. The Center for Budget and Policy Priorities says that this new plan, the Graham-Cassidy plan, would, quote, gut protections for people with pre-existing conditions, impose damaging cuts to Medicaid, and cause many millions of people to lose coverage. This would be virtually identical to a repeal without replacement bill, except for the additional freedom that it would give health insurance companies. Now, Mitch McConnell has asked for this to be fast-tracked by the CBO. The CBO is the Nonpartisan Congressional Budget Office. We're hoping that by early next week, we would have a scoring from the CBO to know, is 32 million accurate, is it not? That would be maybe on the 25th or 26th of the month. They want to vote on this by September 30th. No time has been allocated for actual debate. Once again, it was the Republicans in 2010 who wanted debate before Obamacare is passed. And now they are providing no time for debate before they vote on this abortion of a bill.
Right, you're talking about a fifth of the economy. It would be nice if they could bring it to some committees, maybe getting some Democratic input on it at least. And
maybe.
When it goes to the House, I mean, they're just going to have to sign off on the same bill. They can't draft their own and come with a consolidation process and go to the next one.
There's
right?
no time for anything. And it's by design, right? And when we think about, well, could this pass? Senator Pat Roberts of Kansas is quoted as saying they are one vote away. Now, you might say, wait, one vote away? What happened to all of those Republicans who seem to understand why this is a disaster? They are trying to ram this through by September 30th, which is the last day that Republicans can pass legislation related to the budget with a simple majority, meaning 50% plus one. After September 30th, Republicans would need 60 votes to pass this, and that's not going to happen.
Yeah, and I don't understand how they're so much closer now. He says it's only one vote away because Murkowski and Collins opposed the past Obamacare repeal efforts because it would have ended the Medicaid expansion. This would as well. And John McCain said that he may go on board if the Arizona governor signed off on it.
Yeah, I heard that from McCain.
I don't think he's going to do it.
Listen, they are presenting themselves as being one vote away to make it seem like this has more support. No, when you only need 51 votes instead of 60, you're instantly 9 votes closer without actually having convinced anybody. And we are really at a critical moment in American history when it comes to health insurance. We have an employer-connected for-profit health insurance system that's not working, right? We spend more on healthcare per capita than even really high cost of living countries like Luxembourg and Switzerland. We have this thing called medical expense caused bankruptcies that are unimaginable in many other developed countries. We have Obamacare now. If everybody who supported a for-profit health insurance didn't try to sabotage Obamacare, I've talked about this before, you could actually have Obamacare work pretty well. It wouldn't upend the system, and you would have something that is supported by all. And then Republicans could keep their for-profit insurance plans. You wouldn't see Bernie Sanders talking about Medicare for all with such support because we would have full support for Obamacare. Now we have a proposal from Bernie Sanders to expand Medicare to cover everybody, paid for through a tax that the average family would pay about $1,300 a year for, much less than they pay for health insurance currently, but it would be bad for health insurance companies. That industry would suffer. People would lose their jobs who work within the health insurance industry. There would be pain associated with that, but it would be really good in terms of coverage. And then we have these Republican plans, which have threatened to leave anywhere from 22, 23, 24, now possibly 32 million people without coverage, people who now have it. This is not a small moment for the United States on this issue. It represents some major, real philosophical differences about how life should be organized. Do we see healthcare as a for-profit product like any other that works well in a free market? If you can't afford healthcare, do you consider that to be like not being able to afford a new fancy car or a new iPhone? If that's your worldview, that healthcare is just another product that some people can afford and some can't, that gets you the system we have: employer-connected, for-profit health insurance, medical bankruptcies, price gouging. The other view is that you see healthcare as a basic right that should be afforded to everyone, regardless of ability to pay, not just for moral reasons, not just because the demand for healthcare is not a free market demand curve, but because you realize everybody's better off when we all have access not only to health insurance, but actual health care. It's good financially, it's good for hospitals, it's good from a crime perspective, and this is the battle right now. It's about more than just whether or not we shut down Obamacare's healthcare.gov or end the individual mandate. People will die under these Republican proposals. According to Harvard, 45,000 Americans die every year already from lack of health coverage. And those numbers are 8 years old from 2009. What will the new number be? It's more than a 9/11 every month, people dying from lack of health care.
And we saw in the previous versions of the Republican Obamacare repeal efforts, maybe 20 million people would lose coverage, 21, 22. Now it's up to 30. So I'd imagine that Harvard study of 45,000 people dying every year would have to be revisited and go up exorbitantly.
Oh, it would be higher. There's no way it's going to be lower. And this is why I'm wondering if something even more sinister is going on here, because it appears that with each new version of Trumpcare, it's even more depraved. It's even more immoral. It's almost like Republicans are taking vengeance on the previous versions getting shut down. And you mentioned this earlier, Pat. Will Maverick hero John McCain vote for this one? Will people still be singing his praises on September 30th? I'm not sure.
Lindsey Graham is his best buddy in the Senate.
Lindsey Graham's mere involvement in this proposal already is making me question whether John McCain can be counted on to be the right thing. And I was just thinking yesterday, preparing for the story, I just can't imagine loving money so much that I'd rather endless tens or hundreds of thousands of people die than save a few percentage points of profit for this or that health insurance company. But then I reread this very interesting article in the Scientific American about how psychologists Paul Piff and Dr. Keltner, they ran a bunch of studies looking at whether social class influences how much you care about the feelings and circumstances of others. And it makes a huge difference. When you achieve wealth and status, you significantly experience fewer feelings of compassion for others. Wealth makes us worse at recognizing the emotions of other people. And that may be a factor here. Remember those Obamacare death panels that didn't actually exist? It's coming full circle. It's coming full circle. It's time to call your elected officials. Look them up at whoismyrepresentative.com. I'm on Twitter at @dpakman, and we'll keep talking about this there. The video you just finished watching was made possible by you through the membership program. You can sign up for membership at davidpakman.com/membership. We are viewer-supported independent media. You can use the coupon code IVoted17 for a 40% discount off of your membership.